invite everybody here to come here to sit on the public. I would like to start this meeting by warm welcome to EIT Health Morning Talk, organized by Klaster LifeScience Kraków as a EIT Health Hub in Kraków. This event is organized in conjunction with many other similar types of meetings taking place in Europe, in many places in Europe. This is a second edition of EIT Health Morning Talk this year, when we talk about innovative hospital. But the issue of innovative hospital is being repeated by us since 2 years or maybe longer during this type of talks. Few words about this morning health talk. I have a screen behind me, so you probably see the screen as well. I have to talk to the camera. So I have speakers behind me and the camera in front of me. The EIT Health Morning Talks, we organized this event, these discussions regarding the innovative hospitals, because we think this is one of our strategic issues in Klaster, in LifeScience Kraków Klaster, strategic issues in terms that we have to decide, and we are working to create a common roadmap in which way we can collaborate to make the hospitals a better place for patients. We did have this presentation before from EPAM system when we heard that in any technology, patients should go first, then technology. So our approach is to discuss those issues which influence the innovations being introduced into the healthcare system for the good of patients. And our discussion is less about technologies, more about circumstances, I can say, if we can say so, circumstances which allow technologies to be implemented, adopted in the hospitals and implemented for the good of patients. And we discussed this in the larger notion of open innovation, in which way open innovation concept can be implemented and utilized in order to make this happen. This happen, I mean, we aim for the hospitals to be very adaptive, very professionally managed and organized in a way that they can adhere and adopt new technologies which are growing very quickly. And very often this organizational part of the hospital are not prepared. So we are talking about the hospitals of the future in some way. We have an agenda for today. And in this agenda, we will have a keynote speech delivered by Maria Sanchez Amat, a senior open innovation and innovative procurement manager in EIT Health Germany. Welcome, Maria. Thank you for being with us. And then we will have remote and also on-place speakers, Jakub Chwieczko, Dustin Boutet, sorry if I wrongly pronounce your name. Maciej Furman, he will be from here with us in the studio. We have actually studio here, if you would like to know, a very nice studio. And Dr. Natalia Haraszkiewicz from European Commission, also remotely. So we start with Maria because Maria has a limited time today with us, and so we start with the keynote from Maria, and then we will switch, come back not come back. We will continue with other presenters, and finally, after those presentations, we'll try to engage you and also our people present here in studio for discussion. So, Maria, if you are ready, the floor is yours.
Thank you very much for this nice introduction, and I hope you can see my screen. If you can confirm that you can see my slide.
Yes, we see.
Yes?
Yeah.
Perfect. Thank you very much. So as I've been introduced, I'm not going to take more time, but I'm in charge of doing open innovation, and one part of it could be also the innovative procurement, and we can talk in the next session about it. But today I would like to briefly introduce EIT Health. So EIT Health is a community in health innovation. We have around 150 partner organizations, and we welcome all of you to be part of this community. We are backed by the European Commission, and what we want is to bring all different types of organization that they do have a role in innovation and in moving innovation forward. As you can see, we are present in many different countries with a more active role or having a hub in the places that you can see in blue. And also we cover with InnoStar some other countries, which is part of this community that we are working here, like Latvia, Poland, Slovakia, Czech Republic, Hungary, Romania, Lithuania, Italy, Greece, and Portugal. So we are super happy to increase our presence here, and we welcome you to face together the biggest challenges in Europe. This is part of our goal. So what we really want is to transform the way the healthcare is delivered based on value for all stakeholders. So in a way, we want to strengthen the healthcare system in Europe. We want to push the innovation not only to reach the market, but to get to the hands of the patients and improve their health. So this is a bigger issue and a high impact we want to get, and we count with all of you to get there. And also we want to support the innovation in a sustainability way and to make the healthcare system sustainable in all aspects, not only economically, but also environmentally. So with this little introduction, I would like to go a bit more deep in how we do open innovation in EIT Health in a particular program that we have. So this, for us, this is a collaborative platform for demand-driven innovation. And that means that this involves sharing knowledge and resources to reach, to get this innovation and to move this innovation forward. And as I said before, we want to get to the hands of the patient. So we have identified within EIT Health that there is a big interest for corporates, for healthcare providers and healthcare system. It means hospital, but also primary care, clinics, to innovate outside their organization and not carrying by themselves all the burden to develop something based on their needs. This is why we created this program, and for us, we are a piece of the puzzle to orchestrate, to organize all that in order to allow you to innovate beyond your organization that will build relationships and alliances, but also, as you know, the healthcare providers are usually the needs or the problem holders. And we really want solutions to fit for the purpose. So we really want innovative solutions that overcome a real challenge based on an unmet need. And this is part of the basis of our concept and our methodology. So but due to the heterogeneity of the healthcare system across countries and regions in Europe, this open innovation, we want to open to discover the best solutions across Europe. And this is where EIT Health can support you to widen the scouting capacity and to collaborate outside your local context. So, in here, the objective is to improve the patient outcomes, to reduce the healthcare cost or work towards new models of delivering healthcare based on value, and to accelerate also with an acceleration program, the fast track of adoption of innovation and implementation of the solutions in real settings. Okay, so in a nutshell, as I said, our objective within the program is to identify these common needs and problems between promoters. And I said here is and I will explain you the role of each of these promoters, but it will be a corporate business, a healthcare provider, EIT Health, and later on a solution provider, and translate it to a market addressable challenge. And here, this objective it seems simple, but it is not trivial. Also, because the way we shape the challenge, the way we identify the need, it will really allow us to find the best innovation that solve an answer to this challenge, and that also can be adapted or enhanced to address this challenge. And finally, as I said, we want to accelerate and establish a validation and evidence gathering plan for this innovation, and really to get a concrete proof of concept on how they reply to the challenge, and also to implement then or pilot the solution in real settings. So the key activities here and how we do that is we use a methodology that is bottom, like in different layers. So in a way, we want to really use the demand-driven collaborative approach. So we want to really understand what is the common needs and problems, what is my problem, but how is the market? Is the market ready to reply to your problem? Where is the challenge? The challenge is in the technology. The challenge is in the way we measure that the technology outcome. The challenge is in the way we incorporate this innovation, or is in the business model that we need to change it to be able to procure it. For that, we want this demand-driven collaborative approach, this engagement with innovation providers to really work hand-to-hand with them. And also, for doing that, we have this platform that we facilitate to gather the evidence and the cooperation. And so for us, it's key to really have interviews with ecosystem and key opinion leaders, to have co-creational workshops with all the staff between the promoters, the clinical staff, the business units of the corporate. We also do an analysis of the market and the overall market. And when we are looking for solutions, we also do an evaluation and interviews with the teams that are part of the innovation providers. We continue working with them in a way that we accelerate and adapt their solutions to really fit to our needs and the challenge. And in order to do that, we provide a legal framework that we can all operate, and we facilitate the pilot design and the cooperation. So as I said, more or less here, we have the corporate business that they need to commit to do the market pool, to do technical support, to really put business objectives in improving patient outcomes, that we want to ensure that this program fits for their innovation goals, their business strategy and lines, and also they are investing in evidence and value generation for their products, for their developments. Also for the healthcare system, we want to really cover their pain points, and we want to gather the knowledge they do have in the delivery of healthcare. They provide access to a real setting to pilot the solution. They have the knowledge in the clinical journeys, patient journeys, samples, settings. They have access to patients, and they also have innovation goals in order to transform the way the healthcare is delivered, and also to understand or to get access to a future procurement or reimbursement conditions of these innovative solutions. And the startup or innovation provider, it could be an SME or even a consortia, they provide innovative solutions and cutting-edge technologies to overcome these challenges. They commit with team members. They are willing, they have to have the willingness to pivot or to adapt their innovative solution, and a big interest to collaborate with clinical and commercial partners. And for us, we have the experience in this open innovation methodology. We are a neutral third party with one objective, like to get the adoption of innovative solution, to get to the end user. But we also provide with a large local and cross-European ecosystem access to key opinion leader, expert mentors, governmental bodies, health technology assessment agencies, and everything that it could be needed for this program. And we also have a big track record for a broader scouting and selecting capacity of high quality ventures, and also a wide reach and challenges for marketing and communication this opportunity. So how is the program in a nutshell? So the program has two phases. The first phase entails the frame of this common unmet need and all the methodology to really get in an alignment with the corporate and the hospital and us to set the general objectives, and to also understand what is the problem, what do we want to solve, and then analyzing the market readiness level, analyzing where is really the problem and what is the challenge we want to overcome first. The prioritization of problems will allow us to define where is the challenge, because sometimes we do have a problem, but we really necessarily don't know what is the challenge we want to overcome. And after doing that, we start with the scouting and selection of this innovation, and then the program of adapting and accelerating this innovation. This will end up in a final stage where all the teams can pitch their implementation plan. And we see this first phase as a de-risking mechanism, a way to adapt really solutions to the challenge, and is free for the selected promoter. So EIT Health covers this first part of the program in order to allow you to find the right solution. Then we have a second phase, is where we pilot the solution in a real setting. And here we will test how much this solution is able to provide the desired outcomes. There is a validation mechanism. However, this part is not guaranteed the finding by EIT Health. So collectively, if we want to continue with one of these companies, we need to find sources of financing. So at the moment, we do have open a call for promoters. So if you want to become a promoter, and it's open until the 28th of October, and please feel free to submit your proposal together with a healthcare provider, together with a corporate, and we can cover up to the final pitches. And as I said, the duration of the program is we need to set up and get an agreement. We will put in place all the agreements and NDAs and so on to cooperate. And after that, once we have the agreement signed, we will have interviews, workshops, and we need to collectively write the challenge. That will take around 2 months for us to cooperate. And once we have the challenge written, we will open a call for solution. And once the call is open, we will take care of the dissemination, recruitment, proposal evaluation, teams interviews, and then we will get to a consensus meeting that will take around 2 months. And from there, we will do this accelerator program. But as I said, we are not doing everything ourselves. You will get support in the challenge definition. You will get support in the legal framework, in the partner matchmaking, if you need it. You will get support with market intelligence, so startups, a key opinion leader, validating the market. You will get support in active scouting and marketing activities. And obviously, with this validation and acceleration program, And later on, we will support you also in the piloting testing. But as I said, this is a collaborative approach, and you will have to provide some commitment. So designing a designation of a program manager to ensure the smooth operations of the program. You will collaborate in these co-design sessions for the challenge definition. You will also provide us access to experts in the form of lectures and mentoring during the program execution, and we also would like to count on you for the evaluation. So I think now you would like to know some of the use cases and previous experience we have had with this Open Innovation Program. And here I bring you some numbers and examples. So for the moment, all in all, we have done 5 workshops with promoters, 2 market analysis, and 12 top experts and mentors were involved. We have had only 2 programs. The first one, it was with Tronico in France and the hospital in Nantes, and we were looking for solutions to spread control of sexually transmitted diseases. As you know, is increasing in gonorrhea and chlamydia. And we were looking for solutions that embrace the individual patient journey towards healthcare. Sometimes they are not sure what happened, where to go, when and how to seek care. And also, we want to go beyond the access to reach the best and fastest treatment. So in here, you can see on our website how was the challenge described, and all the information is there, but we received 17 applications. We selected 8 teams, and finally, we selected Sherman Diagnosis for the implementation of the pilot. We are starting now the negotiation of the design of the pilot. And in the case of Takeda and University Hospital of Leuven, we were looking for fast, regular, and minimal invasive remote monitoring of people with inflammatory bowel disease that includes ulcerative colitis and Crohn's disease. And we were looking for 3 main challenges: early detection of flares in inflammatory bowel disease, new biomarkers for this inflammatory bowel disease, and also some the collection or some solution to understand better the behavior of the disease. And this is, as you can see, is a broad challenge, but with clear objectives. And we gathered 22 startup applications. We finally selected 10, and now we are nearly kicking off doing the clinical trial design for the pilot with Nimbio company. So we are very happy that both of them found a right solution and a good solution to continue working with. And here are some testimonials. I don't know if you can see it, but for example, the doctor in the hospital in Leuven was saying that she thinks that a hospital of Leuven will benefit from it and brings a lot of value and opportunities for them. Also, the startup was very happy because they found a very well-organized program, and they were very honored to be the winner. And for them and for the investor, it is a good opportunity. I can share these slides with you also if you want to see. There is very big but very nice testimonials and good collaboration. And nothing else, just wanted to let you know that you can apply for this new opportunity now. And here is the webpage. And remember that it has to be from the same country or innovation region. And you can contact, here is the webpage in applyeithealth.eu. Sorry, it's wrong, the date here is the 28th of October. And also look of the Open Innovation Program in our webpage. And you can also contact our members for information. I think for Poland is Joanna Broy, and she will be happy to support you. And thank you very much for your time today.
Thank you, Maria. I know that you don't have much time, 5 minutes maybe. Do you have maybe questions to Maria? Or from people participating online? If you have questions, it's time now. I must, in the meantime, if you decide to have or not to have question, I'll comment. We learned about this program yesterday, actually, during the RIS Hub summit in Ljubljana, and sounds very interesting, but still it's not clear who is really eligible. I mean, if we as a hub, EIT Health Hub, are eligible to form such a consortium or not. But nevertheless, we are, as I understand, responsible or obliged to promote this approach and find out those who may be interested in the program.
Yes, you can find this consortium, and the way the program is operated is locally. So the hub will have a role and in the program, and we will provide with all the platforms and methodology to operate it. So it's a distribution in between EIT Health and the hub in Poland. But you need to make sure that it is clear the corporate business and the hospital and the need and the problem. The way to apply is very simple. There is only 5 questions. You don't need to have a lot of findings and research behind, because we will do that together. So it's more on an interest or previous conversations that you already had between a corporate and a healthcare provider.
And to make it even clearer, the application now to be this promoter is for hospital and business entity to engage in order to formulate the challenge, and then startups may apply for the program to provide the solution.
Yes, that's it. That will be in February, more or less, the second
great.
one.
So we are on track. Thank you, Maria, for presenting this open innovation opportunity for our community. We will do our best to start in this, to convince our partners to do this. Thank you very much for being with us. How about questions? No questions here, no questions in online. Oh, so thank you, Maria.
Thank you very much.
See you later.
Hope to see you soon. Bye.
Yeah, thank you. And our next speaker, so we'll continue with speakers, and our next speaker will be Jakub Chwieczko from Medical Innovation Institute. You may know Jakub because from his previous appearances in our settings, because he used to collaborate with us and work with us in several occasions. Hello, Jakub.
Hi guys, hello. Unfortunately, my camera is broken, so therefore you cannot see me, and I'm truly sorry about that.
Okay, so we see Andrzej Haremski, but it's not you. It's,
I have more hair than Andrzej.
Okay. Hello, Jakub. Jakub will tell us about scaling innovation in healthcare, key lessons from pilot implementations across EU and USA, and this will be speech about his personal experiences in this area, and Jakub has quite a lot of experiences, but I think Jakub can talk about this better.
Yes.
So Jakub, the floor is yours.
Of course. Thank you, Kazimierz, for the introduction. And yes, I see Andrzej right now as well. That wasn't me. You will see my picture and on the last slide. I'm not sure if you can see my presentation right now.
Now we can see it.
I think it's on. Okay, perfect. So hello again, my name is Jakub Chwieczka and I'm CEO of a Medical Innovation Institute. Medical Innovation Institute is a service provider, a company which helps startups to grow and expand. Our primary goal is to improve the quality of healthcare system and increase the user satisfaction, and we do it by different means. And today I wanted to talk about scaling innovation in healthcare, key lessons from pilot implementations across the EU and USA. And I have to say it's a glimpse and it's a sneak peek of a presentation of a report that we are right now creating. So we are gathering research pilot projects from EU and USA to extract the knowledge from them, to have like a lessons learned on how to successfully implement innovation into the healthcare ecosystem. We are also co-organizing a meeting where 10 big Polish startups will present their business cases and pilots, and we want to put them together to have kind of a benchmark for this scaling in healthcare and pilot implementation. So today I will briefly have an introduction. I will talk about the importance of pilot projects. I will give you some examples of the pilot projects in the EU and the USA, and in the end, key lessons learned, plus conclusions and recommendations. So to start with, I think that all of you are aware of pilots. We have plenty of them as well in Poland. Today, I'm not going to focus on them, but of course, in Poland, we have examples, good examples of pilots that we could share internationally, and we can show to see if they work or they don't work. And what comes to the pilots, so this came to my mind as well while creating this. So your most unhappy customers are your greatest source of learnings, because usually the pilots are done actually at the beginning, before even broadly introducing a new novel technology to the market. And it's a small-scale preliminary study which is conducted to test the feasibility, time, cost, risk, and performance. It can also lead to different changes and possibilities in the product at the early or end stage, mostly, of course, on the end stage, on a real-world feedback. So I think you are all aware of those pilots which are happening, small or big scale, but I'll try to show you the abundance of different pilots as well and their scope. When it comes to the importance of pilot projects, I think the pilot projects are maybe not something specific to Poland because they are done worldwide or to Europe, but I think we love pilots in Europe. So every product which before entering broader market usually needs to be tested in the closed environment, closed setting. It's not a clinical trial, of course, it's completely different. Usually pilots, or most of the time, the pilots are done after the certification. For example, when it comes to medical devices and digital therapeutics, it's usually after the MDR. So the clinical trials should already be done, or if it's comparative study done for the product, sometimes they are not needed, and the pilot is the first real testing of the product. But what kind of challenges do we face when in the implementation and doing the pilots? Most of them are connected with the resistance to change. I think you know that you are all aware of that healthcare is a conservative area. We deal with really important projects, and in cases we deal with human lives. So this is why it's so conservative, and this is why many times doctors are quite restrained to new technologies, to something that they don't know, and something which most of the time and many times they don't have enough evidence-based medicine and proof, I would say clinical proof at the early stage. Because usually this clinical proof will be gathered in the clinical trials, but also after implementation. So most of the practices are quite established and ingrained, and staff may fear disruption, which is normal as well. And new technologies require training. So this is also super important to remember of, to change this resistance into real proper change. And when it comes to viability and stakeholders buy-in, it's also important. Usually different stakeholders have varying interests, which is obvious. So what the pilot needs to do, it needs to address different stakeholders' needs. Usually those stakeholders will be patients, will be HCPs, healthcare professionals, and in the end, it will be the payer. So it can be a hospital, it can be a clinic, but it also can be a big healthcare or insurance system as well, which requires different information than patients do. So providers may resist new technologies as well. Patient and insurers may prioritize costs. So usually the new technologies, when it's brought up, it increases the cost. It may lower the cost in the long term, but at the beginning, usually it's an investment. And the long-term benefits may be overlooked because of that, because we don't see the bright light at the very beginning. But when it comes to the benefits of pilot projects, it's a real-world testing. So the technology it's tested in a controlled setting. It can be simulated and it can simulate actual clinical conditions. We can identify pitfalls and make improvements, and we can gather insights before wide use. So I think this is super important, especially for those technology providers and startups who want to introduce new solution to the market. And then data collection and feedback collection, collect data on effectiveness, which is super important, access, efficiency, and satisfaction, refine technology-based feedback, and build case for broader adoption. While talking to the different big insurance stakeholders and hospitals, usually when we try to introduce them with a new technology, this is actually what they want to see. So either they want to see a pilot which already was implemented somewhere and will prove that there is a business case behind it, or they won't usually, adapt this technology unless the provider will be willing to do a free pilot in their clinic or in their facility. So I'm going to briefly go through those examples of pilot projects in the EU. The best thing, or maybe not the best thing, but probably one of the most important or interesting for you. So what was the outcome of the pilot will be shared a little bit at the end, but in the full perspective, it's going to be shared in the report end of October. I wanted to introduce you to the TRILO project in Spain, which was a pilot initiated at the La Paz University Hospital, which aimed to improve the treatment adherence among oncology patients while utilizing digital health solutions. So the objective was to enhance patient engagement with treatment plans. We know that patients many times are not coherent with the treatment plans. It was supposed to streamline the communication and reduce barriers to adherence. The collaborators on this project was La Paz University, of course. There were collaborations with patients advocacy groups to ensure needs are met, and engagement of healthcare professionals for feedback and technology effectiveness. Expected outcome: increased adherence rates, improved patient satisfaction, and potential insights into best practice for digital health improvement in oncology. So this is a pilot projects where digital technology was used to engage patients into the treatment and adherence plans. The next one is completely different. It's a health circuit project, EU. That was an adaptive case management initiatives aimed to improve healthcare delivery, focused on enhancing patients' outcomes through innovation service, and implemented across multiple healthcare systems in the EU. So you can see a real difference here. While we had one hospital, one solution aimed at the oncology patients, right here you have plenty of stakeholders, plenty of different healthcare systems in the EU, and basically it's an idea of enhancing patients' outcomes through service models. So completely different pilot, but it's also a pilot at the broader scale, bigger scale, international scale, but it can be called pilot and have the similar objectives, a similar structure with the objectives and the outcomes as well. So streamlining healthcare processes for better efficiency, foster collaboration among healthcare providers, utilize technology to manage patients' care dynamically. So that was the expected objectives. When it comes to collaborations, various European healthcare systems, technology partners, collaboration with research organizations. So we have plenty of different stakeholders here, as usually is done in the big EU projects, while usually we have between 10 and even 15 stakeholders engaged into the pilot projects. And the expected outcomes was to develop best practice for adaptive case management, improve coordination of care across healthcare systems, and potential policy recommendations based on successful strategies. So that was a strategic project in difference to the other one that you have seen. Telemedical pilot projects in Estonia. So that's an abundance of different projects and series of projects, telemedical projects on cardiology, nephrology, diabetology, etc., aimed at implementing telemedical solutions. We have some of the examples of telemedical solutions and pilots in Poland as well. To some extent, in the last years, we had something which was called telemedical group, which was functioning next to the Ministry of Health, which focused actually on implementing and on running a couple of pilots on telemedicine, and then trying to do some more. So that's a similar approach that the Estonian government had. They wanted to run a series of pilots to see how they will how they will improve utilization of technology, and how they will actually increase possibility to get to the doctor by Estonian society. So the objective was to improve patients' access to healthcare, enhance engagement and satisfaction, and gather data on effectiveness on telemedical intervention, because we are still debating on situation, is telemedicine actually in the 21st century allowed to diagnose and treat, or is telemedicine only reserved to super minor cases like prescribing e-prescription, giving e-referral, etc., etc. So again, we have a different stakeholders. We had an Estonian government collaborating with healthcare providers, and we had also governmental health agency and engaged patients and feedback on the telemedical experience. So this is super familiar to me with the telemedical table, round table, which we had, but the outcomes here were more interesting, I would say, at least to the extent where we are right now. And expected outcomes: increased access to healthcare services, enhanced healthcare outcomes, and valuable insight. So again, you have three different kind of pilots here. The first one telemedical solution, one hospital, one patient group. The other one was international, focused on actually standards, you can say. And this one was also quite broad, but only restricted to one country, but using different possible tools to see what is the possibility to actually help providers and patients to get better access to care. And two examples from the US: Health Innovation at Home Program, pilot program designed to transform healthcare delivery at home. So we see again that the home care is really increasingly getting traction and attention from the governments as well. I think it's obvious for all of us that, you know, the home care will be, we will be pushing more for the home care and less for the stays and participation in being treated in the hospitals. Here we had the improved management of monitoring of chronic conditions, chronic diseases, enhanced patient engagement, and reduced hospital readmissions rates. As my time is running a little bit, and I want to focus on the last part, which will be the the recommendations. I will skip a little bit because that was similar to the projects from Estonia. An innovative device access pathway, which is even different thing. So this is more similar to the EU projects that I was telling you about. So pilot initiative aimed at streamlining the approval process for innovative medical devices. Last couple of weeks ago, we had a discussion in Poland as well about the fast track for e-solutions for innovation. So basically, I would say that this pilot was addressing the same problems, addressing the same needs. So how to actually implement innovation and how to fast track and fast access new technologies for the better care and patients. And as you can see, it also involved different stakeholders. In the expected outcome was to shorter approval timelines, increase availability, and insights into regulatory efficiencies. But what are the key lessons learned from those pilots and the other one that we had before us in our hands when we were trying to gather the insights? I gathered 9 key lessons for you. So the first one was the importance of stakeholders engagement. The broader we want to go, the broader we want to implement, the more stakeholders we need to engage. And usually the complexity of this activity, of course, increases because the more stakeholders, more people, more companies in the pilot, the more, the harder it gets actually to execute. But in the end, if it's executed in the correct way, in well manner, it's going to be definitely adopted broadly. Then the flexibility and adaptability on both sides. So on the sides of company or stakeholders who are running the pilot, but also while choosing the partner. So if we were talking about the clinic chain or hospitals, we really need to be able to do the pilot with the partners which are flexible and adaptable, because that can really tilt the success rate to us or against us. Then everything needs to be data driven when it comes to decision making, when it comes to the last resort. We have plenty of data points these days. Everybody is running on data. And doing a pilot in a little bit mischieving way might be unsuccessful. In Poland, we have an example of one e-stethoscope, for example, which went under the pilot during the pandemic, but the outcomes, unfortunately, due to different data-driven problems, made and went to a conclusion where the e-stethoscope, the device, didn't actually get the approval of the health technology assessment. So this is super important to have the data right from the start and to gather the data effectively. Then clear objectives and metrics. This is connected, of course, with the data. Collaboration across sectors. It can be sectors as a healthcare providers, business providers, technology deliverers as well, but also around the sectors of, as we mentioned, patients, payers, and HCPs. Focus on patient-centered approaches. Usually what we do in medicine, of course, in the core of the medicine and everything that we do, there is a patient. Healthcare providers, healthcare professionals, payers are important, but in the end, it needs to benefit the patients, of course, at the very bottom of this ladder. Then sustainability planning, engagement in the continuous learning. So after the pilot, we need to take lessons learned to think of what was done correctly, what was a mistake, what can be done differently. So if we scale further, we need to take those lessons into consideration and adapt, and maybe not pivot, but I would say adapt. And effective communication strategies. So we need to communicate both with the stakeholders doing a pilot, but definitely we need to communicate well with the personnel who is executing on the pilot. So nurses, doctors, patients, everybody needs to be really well communicated, and they need to have clear information, because the communication fog which can occur definitely will be a big problem for us in execution of the pilot and then further adoption. So those were the key lessons learned. Conclusions and recommendation really fast, both connected to each other. Stakeholders engagement is crucial, as you've seen. Flexibility and chance of success. Data-driven insights lead to improvement. Clear objectives foster accountability, and collaboration drives innovation. And recommendations which comes out of the conclusions. So prioritize stakeholders' involvement, cultivate an adaptive culture, super important, implement comprehensive data strategies, define clear goals and metrics, and enhance communication practices. I think if we will hold on to those 5 recommendations, more or less most of the pilots can be planned and then executed in a correct and in a good manner. So that's all for me. This is how I look. So again, sorry for not being there live, and sorry for not, you cannot see me on my camera. After this lecture, I'm gonna buy a new computer because my camera is dead. So sorry again. This is my contact number if you want to be in touch. And thanks again, Kazimierz, for the invitation.
Thank you, Jakub, for this presentation. We have now short time for questions. Quick questions now, just fresh after presentation. And again, if not, I have 2 questions, maybe more later. But first question: why did you choose to present examples from Europe and from USA, and you skip any kind of pilot examples from Poland?
Yeah,
you have them.
That's a good question, but this is what we are doing right now. We are preparing to the meeting that we're going to have at the beginning of October, where we're going to present 10 Polish startups which done pilots and done business cases and implement their solutions into the ecosystem. So we are right now in the preparation of the report. This part was a research on how it's done in the Western, let's say, part of our world. The 10 startups which we'll be presenting will be our benchmark when it comes to Poland. Then we want to put them together in one piece and try to, benchmark one against each other and have like a recommendation and lessons learned from both of those topics. But the Polish examples of the pilots, you're going to be able to probably read in our report or see in our meeting at the beginning of October. So definitely something to wait for. So this is like a sneak peek to increase some expectations.
Okay, thank you. And the second related question is about your opinion, because regarding this opportunity, this formal way of piloting the medical technologies in hospitals in Poland, the new regulation was introduced in spring, I believe, this year, after consultations. And during the consultation, in the first phase, it was the definition of innovative project included also organizational innovations. And then in the final version, organizational innovations were cut off and only technological one, medical technologies were left. What is your opinion about that?
Mm-hmm. So just to make clear, we are talking about this health technology assessment pilot kind of a structure recommendations that the Polish AOTMIT run.
Exactly, yes, this one.
Mm-hmm. To tell you the truth, in my opinion, maybe it's super hard. In my opinion, it's hard for health technology assessment bodies these days to assess modern technologies because they change so rapidly and so fast. We don't have many Polish, innovation startups which went under the recommendation of the health technology assessment body and went in the reimbursement. I don't know any, almost any of those. Not even talking about digital therapeutics, which are even a harder topic. And I think that's still our health technology assessment body don't know how to approach it or how to assess it fully. We are in the discussion about this in Poland right now in this moment. So if we are talking about a possibility to have some innovation when it comes to the processes, as you mentioned, I think it's even like an abstraction right now for some of our colleagues. So it would be best, to focus on the medtech and digital health tech, and if we will be able to assess them in a correct manner, and we will have a framework for this, I think then we can go into the part of assessing process innovation.
Which means that it's better to avoid problem than to address this directly in this case.
Step-by-step approach, I think maybe.
Okay, it may sound smart, but I'm not sure about that.
Okay, right now everything is clear, and I hope that I will have to. Okay. Okay. So it will be better for us. Today, I would like to present you. I'm representing Comark SA and our healthcare solutions. And in terms of my experiences and based on our products, we would like to fit in the hospital of the future and how these solutions could be useful for our for the process of building the new concept. So firstly, I would like to say about the context of the virtual hospital, how hospitals can change, because nowadays hospitals and the process of the hospitalization must not be connected only with the process of being in the hospital, because we would like to emphasize the role of the remotely monitoring solutions in pre-hospitalization, but also in post-hospitalization. So the process of treatment can be connected with the telemonitoring solutions, platforms, apps, biosensors. And firstly, I would like to say about the context, how the thinking about the hospitals has changed in the last years based on the troubles, for example, with the pandemic, and how the hospital right now is changed. So right now, I would like to say about the context of that and how hospitals, what kind of challenges they faced. So the healthcare needs, and in terms of the healthcare systems we are facing in developing and in developed countries with the growing healthcare costs caused by the aging population, but also we have a new ways of thinking about the patients, that the troubles of patient centricity and patient empowerment is so crucial for the perspective of the healthcare system. Also, these two challenges also will face with costs, and also we have to take into account that we are living in an environment that must change in terms of the process of electricity and also paying the bills. So for the perspective for the Polish hospitals, the new troubles, the new challenges faced with the process of billing of the higher cost is facing. And now we have to say about the future positioning of hospitals, that hospital consists of the, I can say, kind of triangle. So we have inside the hospital facilities, so I can say the traditional attitude to the hospital, that we have the many of the wards, and based on that we build a hospital environment, but the process of hospitalization is not only connected with the building, but also with the process of remote monitored and something like a management of chronic diseases, and also building an early diagnosis, because in our company we have special apps connected with something like a patient engagement. So it means that patients take measurements, for example, temperature, blood pressure, everything. I mean, this application is connected with the biosensors, and the biosensors gave these measurements, and then we send this information to the telemedicine platform, especially prepared by our company, prepared by Komar. And based on that, we can monitor patients in a very quickly way, and also longitudinal, not only in the perspective of the being in a hospital. So the virtual hospital, the next thing I want to say, that it's connected with these challenges, like improving treatment. Also, we have a kind of levers like building also the kind of digitization. And in terms of the hospital facility and how the acute and complex care can change, is that we have something like a virtual hospital, so connection with the process of remote monitoring of patients, and also it can be connected with the all other parts of the healthcare system, like GPs, pharmacies, retail clinic, laboratory, and radiology center. So also the all kind of these solutions can build the hospital virtual solutions, and thanks to that, it makes patients more stable, and thanks to that, have a possibility to build the longitudinal kind of treatment without troubles and lacks of access to healthcare solutions. So in terms of the levers and outcomes, we can also, thanks to the building virtual hospitals, make something like a better coordinate care, or even creation the coordinate care. And in the previous slide, I wanted to say that we also have an opportunity to making this continuity of care. And then also thanks to these platforms, thanks to making apps, we can engage patients. And thanks to that, their empowerment, quality of life, and all issues could be improving. It could be improved by having this opportunity. So in this part, I wanted to say that a virtual hospital could be connected with the process of building the better outcomes for the patients. So it also would be very useful for the perspective of patients. And now I would like to say about the process of having the clinical outcomes. So firstly, we have a connection with the biosensors and with the solutions of electronic health record and something like making a repository of data. So thanks to this data, we can compare how the patient looks like in the whole process of treatment. And thanks to that, thanks to the telemedicine solutions, we also build diagnosis earlier and treatments earlier. In terms of the remote care solutions, we have this kind of triangle that we need a biosensors, so something like external devices, then the patient app and the telemedicine platform. In this kind of solution, we worked in one of our solution, home health, that we have connected biosensors, patient app, and all of these measurements are connected with the telemedicine platform. And also in terms of the automation, we also have to take into account that the new kind of changes has made connected with that we have many of robots, for example, in urology, that we have many of the 3D printing solutions, for example, for printing limbs. So in this part, the virtual hospital and thinking virtually about the process of care is changing in the last years. So the second point we would like to emphasize, it's building the solution ecosystem in Comarch. Then in Comarch, we have a special home health app. I told you about it. And also this kind of solutions. Sorry, I have to move. Okay, so we have a kind of solutions like home health diagnostic points. So home health is an app for the patients to remotely monitoring their measurements. And in the diagnostic point, this is a special kind of kiosk. When we make a measurements and patient can be even outside, and by that have this kind of measurements. Our company is connected also with the part of the HIS and electronic health record. And also we are doing, we are collecting the data repository. So in terms of the health population management, we also have many of the solutions. So we can divide our solutions into telemedicine solutions and in the hospital cloud solutions for the hospital. So we can merge it for remotely monitoring system, and then to build the process of making an appointment in the hospital. So we can, for example, we can create a use case that we need an acute care, and then the process of post-hospitalization could be provided by our application, and thanks to that, build the all of the process of hospitalization. And it is connected thanks to our internal platform, in which we have many of the features like building. I would like to go to the previous slide, because in the eCare platform, we try to manage data and alarms. For example, if someone has an event, has a exceeded amount of the, for example, blood pressure, everything can be analyzed here in eCare, and also the medical professional who is responsible for organizing treatment has the special information that something was wrong with this patient. So also we have a special possibility to connection with the patient by chat, phone, and video, and making and creation something like a personality of thresholds and test plans. So the eCare is in terms of the telemonitoring, and also in terms of creating virtual hospitals in post-hospitalization, a clue for building this kind of pathway model. And our other products are connected with also eCare. So eCare is a platform which connected all of this, which connects all of this kind of products, like our special wristband for the elderly people, and we are developing this one of the project in for the Lesser Poland, for the Lesser Poland Voivodeship, TeleAngel. And we also have many of the connections with the external devices. As I said, we have many of the integrated devices with diagnostic point and home health app. For the process of building virtual hospital, I think the most suitable project is home health, because it's a product, it's an application for individual patients who are diagnosed, and based on that, this patient could measures their vital parameters. So in terms of the other things, we have to take into the account how all of things will track, and also that we have been a connection with the IoT platform, and also apps for staff. Also, we can build something like a digital command centers for management in the process of building virtual hospitals and making a business intelligence solution. So to process all administrative data for the electronic health records and medical data. Everything can be analyzed also thanks to the features of our platforms. So in terms of the outcomes for the patient expertise, also we have to remember about the patient pathway. So it's also can be something like organizational innovation for the hospitals, that we can accelerate the process of patient pathway and better process of taking on appointments. Everything, of course, is connected with the process of the patient empowerment thanks to this application. What I've said, the home health application is the best from our perspectives, and thanks to that, the quality of life also can improve thanks to the longitudinal process of care, and also our solution. So the diagnostic point that we can have a good product for the prophylaxis. So the prophylaxis process could be engaged thanks to having a sensor, having an application, and a special place where the process of treatments can be started actually if something went wrong in terms of the measurements. So this is our main products, and this is a special contact for me. If you will need any additional questions, please let me know. And thanks to for the occasion to representing Komar during today's presentation. Thank you very much.
Thank you for this presentation. So again, we've seen a very complex proposition regarding in which way the hospital of the future can be organized, and I understand these systems already are operational. That means everything what you have shown us is somewhere implemented.
Yeah. For example, I said about the post-hospitalization process, but we are developing something like a pre-hospitalization process because, for example, hospitals need to have healthy patients going into the hospital. So, for example, in terms of the bariatric patients, they need to be healthier than going into the hospital on the procedure. And thanks to that, we are developing a project with one of the institute, the Mother's Health Institute in Łódź. And thanks to that, we try to build something like a pre-hospitalization using home health. So for example, a few months before the procedure, the patient started to take a measurement and try to improve their treatment, their vital parameters. And based on that, the whole of the procedure, for example, surgical procedure, could be less problematic in terms of the further consequences. So yes, it is implemented in terms of.
But my question was a little bit from different perspective because as we've seen here in this example, organizing, putting this in simple words, organizing the future of the healthcare system is so much complex because there's so many dimensions of this process. And maybe I will phrase it a different way. What is interesting, if we put this on the line, the total customer or patient experience. So before he becomes sick, then when he notices that something's going wrong, takes the diagnostics, then they takes cure, then takes after treatment procedures. What is missing now on this total patient's experience? Are you aware what is missing, or do you think that you cover everything on this path?
I think it should be a good question for the collaboration between the companies and the hospitals, because hospitals want to have a patients in a good condition, and thanks to the IT solutions, it could be more feasible. I mean that from the perspective of the hospital, the reducing costs also would be available by reducing the consequences of the bedsides of the procedure. So, for example, if someone had a surgical procedure and something went wrong because, for example, his or her obesity, and to reduce lose their weight before the process of the procedure. So I mean, this is very useful for the perspective of the hospitals to cooperate with this kind of solutions, with this kind of applications.
Yeah, it looks like the problem is more systemic and it should involve much more players in this discussion. Thank you very much. We are a little bit in a hurry and we may have an emergency situation. It's fine. Okay. Okay. So thank you for this. Yeah, of course.
Maciej, thank you for giving your speech. I will refer to one of your slides that you shown like data collecting devices, and there were also like wearables. I especially paid attention to the Comarch watch. Can you say in your words, how does it compare to like industry standard wearable devices like for instance, Apple Watch?
Actually, Apple Watch is not our direct rivals in our process, yeah, because mainly Loxon and HRP is our rivals on this, our competitors on this market, because our bracelet is mainly connected with the project. So I mean, for example, the many of the Apple Watches has many of the features, and our bracelet is using mainly for the elderly people. Yeah, because we are.
It's not the watch, by the way.
Yeah, it's kind of wristband.
Okay.
So it's kind of wristband. So in this wristband, we have a SIM card for making an SOS connection between the elderly and, for example, a paramedic, because we are working the two models with the application. So in this application, we have a non-professional carer, someone from the family, for example. And in the model of connection with the e-care, we have, for example, a professional paramedic who is responsible for receiving a call from the elderly people. If something went wrong, for example, our solution could recognize fault detection with an accelerometer inside this bracelet. And in terms of our rivals, in terms for example, the vital parameters, the fault detection is mainly connected with this kind of bracelets like us. So we don't have watch, something like an Apple Watch for the entertainment solutions, but mainly for the medical measurements like saturation. Our bracelet measures saturation, also temperature, also steps. So it's more a use case for the medical perspective, but it's not a medical product, because creating this kind of device as a medical product is very complicated, also based on the MDR guidelines.
Understood. Thank you so much. And the last question, where do you store this data?
We store this data on the platform, so we can compare. For example, in the model of the e-care, we collect this data. For example, we collect all of the saturation level of each 30 minutes, and based on that, we can something like a compartmental functions. And thanks to that, this data could be comparable day by day. So we collect this on our own platform.
And this is like a cloud-based platform?
Yeah, no, this is a web platform. The e-care is a web platform, and yeah, we collect this on our solution, our cloud.
Okay, thank you.
Thank you for this presentation, and we'll move to the last but not least presenter, Natalia Hraszkiewicz, from connecting with us with, I'm not sure, from Brussels. Hi, Natalia.
Hello, can you hear me? Well,
yes, we can hear you.
Okay, great.
So welcome to our meeting. I was asking, are you connecting with us from Brussels, I believe?
Oh no, currently I'm located in the Netherlands, so close to Brussels, but not in Brussels at this moment.
Okay, you will be talking about the enhancing patient-centered. We lost this for the moment. We did have your presentation. No, not now. We are waiting for your presentations to be presented on the screen, and tell us quickly, or maybe not so much quickly, what will be your speech about. Now you are muted. Sorry, you are muted, Natalia. We don't hear you. Okay. You've been muted for a moment, for a while.
Natalia, I shared the presentation for you, so.
Okay. Yeah, I think it's better. It's better.
Okay, so we don't have to wait anymore. So Natalia, the floor is yours, and please.
Okay, great. So thank you very much. Thank you for your invitation. It's great to be here today. And I will talk about coordinated, integrated care in the context of cancer patients and in the context of oncology treatments. So next slide, please. Is it possible? Okay, thank you. So we'll talk about challenges and opportunities in cancer care in the European Union. We will discuss about two major programs, namely the European Cancer Mission and the European Beating Cancer Plan, and how these two programs enable development of patients and people-centered, integrated, coordinated care. We will also discuss briefly about transformation of oncology health services and systems by using open innovation and appropriate regulatory and policy paths. And finally, I will conclude my presentation with recommendations. Next slide, please. So there are two major European programs. Sorry, one before, please. So there are two major European programs, namely Horizon Europe, which comprised 46 projects, and Europe for Health. These two programs support the European Cancer Plan and the Mission Cancer programs. And in addition, we have also other programs like Digital Europe, or Interregional Innovation Investment Instrument, known popularly as I3 instrument. We have also different kind of funds, for example, Cohesion Fund, which support also innovation in these areas. So, for example, European Beating Cancer Plan is constrained from 11 flagship initiatives, and it supports areas of innovation in order to better understand trends across countries and regions and progress, as well as support investments and policy initiatives. Next slide, please. So the global economic cost of cancer, because of course cancer is a global problem, it's a global challenge. So between 2020 to 2050, the global economic cost was estimated to be $25 trillion. And this translates to an annual tax of 0.55% on the global world product. The economic burden and the health burden are distributed in an unequal way across countries and across regions. Next slide, please. So across 27 European countries, an estimated 2.78 million new cancer incidents were diagnosed in 2020. And according to projections, an increase of 20% is expected by 2040. And moreover, mortality rates are also expected to increase by 24% in countries like Austria and Belgium, and up to 45% in countries like Portugal and Slovenia. We also recognize that there are significant differences in cancer mortality rates by regions. Next slide, please. So, according to the European Synthesis Report issued by the European Commission, by DG Santé in 2023, in some countries, one can recognize that there is lower density of physicians and diagnostic and radiation equipment than the European average. And these countries are located on the lower left square in this graph. Next slide, please. Here I would like to comment a little bit about the cost of cancer care in Europe. So in 2018, the total expenditure on cancer in, at that time, 28 member states, because England, Great Britain belonged also to the European Union, was estimated to be 185 billion euros. And the costs are distributed according to four main categories. So direct costs, which relates to health expenditure on cancer care. And it also covers cancer drugs. So this accounted for 51% of total expenditure on cancer. Then we have indirect costs, for example, productivity loss from premature mortality or productivity loss from morbidity. And these two categories together accounted for 35% of total cancer costs. And then finally, informal care costs, for example, services provided by relatives and friends or family. And they accounted for above 10% of the total expenditure on cancer. Total cancer costs are pretty high in some European countries like Germany, France, Italy, Spain, and the Netherlands, and they vary between 46.6 billion euros for Germany and 10 billion euros for the Netherlands. Next slide, please. But when we are talking about disparity in cancer treatment, we also have to mention access to cancer therapies, which is also unequal across member states. So, for example, patients in Germany wait for new oncology medications for about a quarter of a year, whereas for example, in Lithuania, oncology patients wait for even up to 2.5 years. There are also differences in accessibility of certain medicines. And again, in Germany, 46 oncology medicines are available for patients, whereas in Lithuania, only 3 of them. Next slide, please. So, cancer inequalities across Europe are also related to early diagnosis, for example, inconsistent screening strategies or different vaccination rates across member states. This is additionally driven by socioeconomic and demographic inequalities and by healthcare system inefficiencies. Next slide, please. So according to research, circa 30% of health spending may be considered wasteful. So coordinated integrated health services delivery could be a solution for this problem. They could act as a vehicle to improve the organization of healthcare systems. And the main objectives of coordinated integrated care are optimizing the health services delivery functions, enabling people-centered healthcare systems, and leading health services delivery transformation. And this, of course, relates very clearly to factors relying to people, to culture, and leadership. Next slide, please. Here I would like to show you one practical example of integrated coordinated care, namely Poland's Primary Health Care Plus pilot program. This program focuses on people-centered integrated care, and it was supported by the Global World Bank as well as by the European Commission. It's aligned with value-based healthcare, and in a typical situation without pilot, primary healthcare system in Poland is composed of general practitioners, nurses and midwives. Whereas during the pilot, additional services were integrated. For example, outpatient specialistic care, ambulatory physical therapy, as well as different health checkups, which relate to additional implementation of additional functions like educator, dietitian, psychologist, or physiotherapist. And in addition, also disease management programs were introduced. Next slide, please. So benefits of the PHC Plus program include improvement care coordination, reduction of fragmentation of healthcare systems, improvement efficiency through optimized resource use, and further enhance services quality and fostering the culture of innovation. Next slide, please. Another example is the introduction of an additional unit within the framework of designing of healthcare services changes, which is called hospital-based health technology assessment. So hospitals are the entry points for new and innovative technologies. So HBHTA is based, of course, on scientific knowledge and relevant hospital-specific information, and it helps to make investment decisions. This unit helps to make investment decisions, which allows hospitals to become more efficient and more aware about investments which are needed for the hospital. Next slide, please. So according to research, process management, integrated services delivery, and data analytics are points to be incorporated in order to improve healthcare inefficiencies. Next slide, please. And here I have for you cancer efficiency metrics. This matrix has three aims: improve the care experience, improve population health, and reduce health costs per person. So one company with the name AllCan cooperates with the university medical centers in Amsterdam and in Rotterdam, and they proposed 8 major metrics, efficiency metrics, to apply to measure cancer efficiency. So some countries, as you can see, for example, Norway implemented all of them, so 8 metrics, whereas Poland or Spain, they just put some priorities and they decided to adopt only 4 of them. I just mentioned the company, which is called AllCan, which cooperates, for example, with the university medical centers in Amsterdam and in Rotterdam. And they, because there are a lot of different cancer efficiency metrics, above 100, and they propose to select 8 major metrics to be applicable. So some countries adopted these 8 metrics, whereas other countries, like for example Poland and Spain, they prioritized some determinants and they decided to adopt only 4 of them. So for example, for Poland, and you can also have a look at these columns here. So Poland decided to adopt determinants like time to diagnosis, then the percentage of cancer diagnosed through emergency presentation, and then time from tissue diagnosis to treatment. And the last one was the percentage of patients receiving chemotherapy in last 14 days of their lives. So you can see here that Poland prioritized these determinants, and they they were not focused on patient experience or patient's involvement in decision making. Not only Poland, of course, other countries as well, as you can see. And this brings me to the last topic. So it's about health technology assessment regulation. So nowadays, there are a lot of discussions about implementation of this regulation, and a lot of pilots are ongoing. So this regulation ensures an efficient use of resources and enhances the quality of health technology assessments across the European Union. So the purpose is to establish efficient, sustainable healthcare systems and engage various stakeholders. So this regulation will be applicable starting from January 2025, so in fact pretty soon. And first, it will be first applicable for medicines with a new active substance against cancer, as well as advanced therapy medicinal products. So in other words, more cell and gene therapies. The regulation describes and proposes the scoping process on the European level, which relates to so-called PICO methodologies. It relates to population, intervention, comparator, or another control and outcomes. And whereas some processes will be on the European level, other will remain responsibility of member states. So member states will draw conclusions on added value of a new technology, and they will also make independently decisions related to pricing and reimbursement. And next slide, please. So here you have a HTA governance. So we have member state coordination group on HTA, and this group is comprised mainly from HTA bodies. We have 4 subgroups which cooperate with each other. Then the next body is HTA stakeholder network. So there are organizations which cooperate with subgroups and with a member state coordination group. There are representatives of different stakeholders. And recently, actually, during the last 1 year, there were 7 awareness events organized across different member states. So it was a series of meetings which the idea was to provide more information about this regulation. So recently we had an event in Hungary on 6th of September. And in November, there will be the last meeting in this series for stakeholders from France and from Germany. So I would like to invite everybody to have a look on the website of the European Commission, DG Sante, Public Health. You will find much more information about this regulation and other events. Next slide, please. And this brings me to final conclusions and recommendations. So to improve cancer care, we should focus definitely on patients and people-centered integrated care, take into account additional determinants if applicable, engage all stakeholders, align with value-based healthcare. And here I would like also to stress the prominent role of nurses as coordinators, educators, and specialists. It's also very important to leverage new technology and data, and this can be done by, for example, implementing pilots to explore, evaluate innovative solutions related to product and services, and innovation procurement. So next slide, please. And one more click, please. So thank you very much. And next slide, please. One more. Thank you. So, yeah, the floor is yours. I will be happy to take questions.
So again, thank you for those who still are with us. Questions, yeah. You have to approach this. You have to approach us to be in.
So in terms of the HBHTA, you said that it's a new approach to the thinking about the HTA from the perspective for the perspectives of the hospital, and because I took part in this in kind of programming kind of project regarding to the implementation HBHTA in Poland, and the results said that many of our stakeholders are not so mature in terms of the implementation of the HBHTA. So can you tell us the good practices of implementing HBHTA in the European hospitals? In which countries is the best developed?
Yeah, so thank you very much for your question. I must say that today I'm also talking about innovative solutions. So implementation of hospital-based HTA unit is also something new. And if you looked carefully, there was just a pilot taken from Horizon Europe program. So we are still experimenting on this. If I'm not mistaken, there are some good results obtained in some hospitals in the Netherlands. So, for example, the hospital, the medical hospital center in Rotterdam and in Utrecht. So, but it's still it's a pilot. So there are just projects on a smaller scale in order to understand advantages of implementation of such a unit, as well as to explore barriers for implementation.
Thank you for your clarification, explanation how the project is going on.
Okay, thank
You're welcome.
Any more questions? We have to finish our meeting today. There are probably a lot of the questions or maybe issues to discuss, but there will be continued off the screen. Offline here in the place. Now we invite everybody here in the studio for the tour to visit the Innovation Garage. Thank you, Natalia, for your presentation.
Thank you very much.
And
thank you for the invitation.
Now we invite everybody. We can switch back. Now we can switch to Polish, I believe, because in this way, with this presentation, we end we are terminating ending the morning health talk event, and we'll continue discussions here in EPAN in Polish, and we'll invite everybody to go to the tour. Thank you very much.